To transfer a patient from a bed to a stretcher, obtain a slide board or other friction-reducing device and secure the help of 2 assistants. A third assistant may be used, if needed, to support the patient's head and neck during the transfer. Raise the bed and position 2 assistants on the side of the bed to which the patient will be turned, while you remain on the other side. Make sure the bed brakes are locked. Lower the head of the bed as much as the patient can tolerate. Support the patient's head while you remove the pillow. Next, lower the side rails on the bed. Then cross the patient's arms over her chest and help her cross her ankles.
On the count of 3, we're going to roll you towards us. 1, 2, 3.
On the count of 3, turn the patient onto her side toward the 2 assistants, moving her as a unit in a smooth, continuous motion. Slip the sideboard under the waterproof pad. Then gently roll the patient back onto the slide board. Adjust her position to center her weight on the board. Now line up the stretcher with the bed and lock the brakes on the stretcher. Stand on the side of the bed without the stretcher. Make sure the other 2 assistants are positioned on the opposite side of the stretcher. If you like, position an additional assistant at the head of the bed to support the patient's head and neck. On the count of 3, pull the slide board with the patient onto the stretcher.
We're going to go all the way over. 1, 2, 3.
Then position the patient in the center of the stretcher and remove the slide board from under her.
Count of 3, we're going to pull you over and take the slide board out from underneath you. 1, 2, 3. Okay, and back down.
Raise the side rails on the stretcher. Raise the head of the stretcher if doing so is not contraindicated, and cover the patient with a blanket. Perform hand hygiene. As part of your follow-up care, monitor the patient's vital signs. Note her response to the transfer, and ask if she had any pain during the move from the bed to the stretcher. Record the procedure, including any pertinent observations, such as signs of weakness and the patient's ability to follow directions and assist. Inform the next shift or other caregivers of any assistance that might be needed.